The physiology of breathing. Understanding ventilation. Welcome to today's episode, where we embark on a comprehensive journey through the physiology of breathing, also known as ventilation. Breathing is the essential process by which our bodies move air in and out of the lungs, enabling the exchange of gases. This exchange, oxygen absorption and carbon dioxide removal, is fundamental to sustaining life. To maintain the balance required for homeostasis, breathing relies on mechanical, neural, and chemical regulation. Mechanics of breathing. Let us begin with the mechanics. Inspiration, or inhalation, is primarily an active process. The diaphragm, our principal muscle of respiration, contracts and moves downward, accounting for approximately 75% of the air we inhale. Simultaneously, the external intercostal muscles contract, lifting the ribs in what is often referred to as the bucket handle motion. This expansion increases the volume within the thoracic cavity and reduces the pressure inside the pleural space, dropping from around -5 centimeters of water to about -8 centimeters of water. As a result, the pressure in the alveoli, the tiny air sacs, falls just below atmospheric pressure, drawing air into the lungs. Expiration, or exhalation, is typically passive during rest. The diaphragm relaxes and resumes its dome-shaped position, while the elastic tissues of the lungs and chest wall recoil, increasing alveolar pressure above atmospheric levels, which pushes air out. However, during exercise or forced breathing, expiration becomes an active process. It involves the contraction of internal intercostal muscles and abdominal muscles to expel air more forcefully. To provide further clarity on these pressures, atmospheric pressure, generally measured as 760 millimeters of mercury, serves as the reference point for airflow. Intrapleural pressure, typically around -5 centimeters of water, is what keeps the lungs inflated against the chest wall. Alveolar pressure fluctuates, driving the inflow and outflow of air between negative and positive values during the breathing cycle. Gas exchange and transport. Transitioning to gas exchange, we look at how oxygen and carbon dioxide move between the air and our bloodstream. Alveolar ventilation is calculated by subtracting the volume of air that remains in the conducting airways from the total volume of air inhaled, then multiplying by the breathing rate. The typical alveolar ventilation at rest is approximately 4 to 5 liters per minute, which determines the partial pressure of carbon dioxide in the arteries. Gas diffusion across the alveolar membrane is guided by Fick's law, which states that the rate of diffusion depends on surface area, pressure differences, solubility, molecular weight, and distance. Oxygen enjoys a significant difference in pressure across the membrane and reasonable solubility, making its diffusion efficient. Carbon dioxide, though it has a lower pressure gradient, is about 20 times more soluble than oxygen and thus diffuses even more rapidly. Now, considering oxygen transport, only a small fraction is dissolved directly in plasma, while the overwhelming majority binds to hemoglobin molecules within red blood cells. The relationship between oxygen and hemoglobin is described by the oxygen-hemoglobin dissociation curve, which has a sigmoidal shape due to cooperative binding. Carbon dioxide, on the other hand, is transported in 3 main forms. About 70% is converted to bicarbonate ions within the red blood cells, 23% binds to hemoglobin to form carbamino compounds, and the remaining 7% is simply dissolved in plasma. Regulation of breathing. Let us now discuss the regulation of breathing. Control centers located in the brainstem, specifically the medulla and pons, coordinate the rhythm and depth of breathing. The dorsal respiratory group in the medulla sets the basic rhythm of inspiration, while the ventral respiratory group becomes active during increased respiratory demand, such as during exercise. The pons contains the pneumataxic center, which limits inspiration to regulate the breathing rate, and the apneustic center, which prolongs inspiration and reduces respiratory rate. Peripheral chemoreceptors located in the carotid and aortic bodies respond rapidly to decreased arterial oxygen, elevated arterial carbon dioxide, or decreased blood pH. When oxygen drops below 60 millimeters of mercury or carbon dioxide or hydrogen ions rise, ventilation increases almost immediately. Central chemoreceptors, found in the medulla, primarily sense changes in carbon dioxide by detecting alterations in the pH of the cerebrospinal fluid. This central mechanism is the primary driver of ventilation in healthy adults. Additionally, the Herring-Brewer reflex plays a protective role. Stretch receptors in the lungs prevent overinflation by inhibiting further inspiration once a critical volume is reached. Clinical correlations. Let us briefly explore several clinical scenarios. In chronic obstructive pulmonary disease, COPD, the airways become narrowed, leading to increased resistance and making it difficult for air to flow out. As a result, individuals often experience prolonged expiration and may use pursed lip breathing to facilitate airflow. Asthma is characterized by episodes of bronchospasm, which constrict the airways and reduce the peak expiratory flow, commonly resulting in wheezing and difficulty breathing out. Acute respiratory distress syndrome, ARDS, presents another challenge, where the lungs lose their normal elasticity and become less compliant. This causes patients to breathe rapidly and shallowly in an attempt to maintain adequate oxygenation. In the case of obesity, the additional weight on the chest wall reduces the lungs' functional residual capacity, increasing the overall work required to breathe. Finally, in metabolic acidosis, such as that seen in diabetic ketoacidosis, there is a significant drop in blood pH. The body responds with small breathing, characterized by deep and rapid breaths, as it tries to expel more carbon dioxide and correct the acidosis. These clinical examples highlight how disruptions in different components of respiration can lead to characteristic changes in breathing patterns. Summary in closing, breathing is an intricately coordinated process involving mechanical actions, gas exchange, and neural regulation. It is sustained by feedback loops that monitor pH, carbon dioxide, and oxygen levels. Disruption in any component can result in compromised respiratory function, such as hypoventilation or hypoxia. Thank you for joining us on this exploration of the physiology of breathing. Stay tuned for our next episode as we continue to illuminate the wonders of the human body. It's the Everything Surgery Podcast. Dissect the extraordinary.